day everyone, I am Hanilin Paras and today I will be performing a return demonstration in the assessment of heart and central vessels, peripheral vascular system, and abdomen. So in this procedure, the assessment is to check the doctor's order and gather all equipments needed. So for the evaluation and documentations, documents finding for the client's records. Good afternoon, sir. I am Hanilin Paras, your student nurse for today. So, sir, may I know your name, sir, for identification only?
My name is Major Angelo Celoon.
How about your age and birthday, sir?
I'm 20 years old. October 27,000.
Okay, thank you, sir. So today, sir, I'm going to assess your heart and central vessels, peripheral vascular system, and abdomen. So the technique procedure that I will be doing, sir, is to inspect, palpate, percuss, and auscultate. So expecting na po that I'm going to touch some parts of your body, then maka-experience ka po ng discomfort. So is it okay with you, sir? So, sir, this assessment is the purpose are to determine if you have any signs of abnormalities. So, I assure that the result of this assessment is confidential and discussed only for the physician. So, is it okay, sir? Okay, so our first assessment, sir, is I'm going to assess your heart and central vessel. So, in this assessment po, I'm going to inspect and palpate only. So, before that, I have some question po regarding to your history. So, do you have family history of incidents and age of heart disease, high blood cholesterol level, blood pressure, like stroke and obesity? How about your, sir? Your past history about heart murmur, rheumatic fever, heart attack, varicosities, or heart failure. Then next, sir, is symptoms that indicative your heart disease and also po presence of disease, sir. May presence of disease po ba kayo ngayon? Your lifestyle habits, sir, that can risk factors for cardiac disease. So, okay, sir. So first, I'm going to sanitize my hand first. So, sir, in inspecting and palpating, so I'm going to palpate and inspect your precordium area. So, the aortic area. So this is, sir, the pulmonary area, the apical impulses, and the tricuspid area, the epiphyseal area also, sir, to determine if may abnormal po ba or may sa pulsations ninyo and sa hips ninyo, sir. So, but before that, sir, can you please lie down, sir? This area po. Okay, sir. Check ko na po yung chest niyo, sir, ha. Pwede ko po bang ipataas yung damit niyo, sir? Magsabi lang po kayo, sir, ha, if masakit po ba siya. Expect me. Pwede po ba kayo mag-move sideward, sir? Dito po sa, doon sa gilid na lang, sir. Sir, ha, pwede po pang yung position nyo po. Yan. Okay, sir. Next, sir, is I'm going to auscultate your chest. Balik mo po sa position mo, sir. So, there are no signs of abnormality, sir. Like, yung sounds is normal lang po siya. Next, sir, is I'm going to assess your carotid area. So, ang carotid area niyo po, sir, is dito po sa neck banda. So, can I palpate and auscultate your carotid area, sir? Sabi lang po kayo, sir, ha, if masakit po ba yung pag-palpate ko? Sakit po ba, sir? Okay, thank you, sir. So, next, sir, is I'm going to assess your jugular veins. So, sa jugular veins niyo po, sir, is dito pa rin siya, banda sa neck niyo. If may signs po ba siya na abnormalities, like, yung yung mga veins niyo po, makita na po. Okay, sir. So, there are no signs of jugular pressure vein. So, if meron po siyang signs, sir, is i-measure ko po siya into centimeter. So, wala naman siyang signs, sir. So, there are no signs of abnormalities po, sir. That's all po, sir, for your heart and central vessels. So, our next assessment is your peripheral vascular system. So, I have some question po regarding to your history. So, first question po is, do you have history of diabetes mellitus?
Wala.
Home parental nutrition means valid options for improving your health condition.
Wala din.
Okay. Your high cholesterol po.
No.
Obesity, varicosity, meron po ba?
Wala.
How about your lifestyle, like food, vices, like naga-drink ba kayo ng alcohol?
Occasionally lang.
Okay. Then, any symptoms of peripheral vascular disease like buttocks pain and weakness in your legs, ma'am?
Wala.
Wala. So, how about your occupation po? How about your occupation, ma'am?
Online work.
Online work. Okay. So, now po is I'm going to inspect your arms for bilaterally for size, presence of your edema, like nagapangkupong ba siya or nagaswell ba siya, your skin color, nail carving. So, okay, ma'am, I'm going to inspect. So, ma'am, can you do this, ma'am? Okay. Okay. So, next, ma'am, is I'm going to palpate your fingers, hands, and arms for checking the temperature. Also, ma'am, is for your radial, ulnar, and brachial pulses. So, I'm going to palpate, ma'am, ha? Magsabi ka lang po if masakit po ba siya. Sakit po ba, ma'am? Other hand po. Okay. Ganyan lang ka lang po, ma'am. Check ko lang po yung temperature mo, ma'am, ha. Okay, thank you po. The next po, ma'am, is capillary refill. So, magsabi ka lang po rin, ma'am, ha, if masakit po ba. Okay, normal. Other hand po. Okay. So, next, ma'am, is I'm going to palpate your ephetrophlear lymph nodes behind your elbow in the groove between the biceps and triceps muscles. So, ma'am, I will elevate your arms into 90 degrees. This po. So, check ko lang po if may signs po ba siya ng abnormalities. So, this is your ephetrophlear lymph nodes. Sakit mo ba, ma'am? So next, ma'am, is I will perform Allen test by occluding the radial and ulnar arteries. So can you please open and close your hand, ma'am? So in this test po, we will know your blood circulations of hand. So can you open and close your hands po for as quickly as possible, and squeeze your hand tightly po like this, ma'am. Oh. Like if okay po ba? Sige, ma'am.
One.
Okay. Okay po. Yan. Close your, like this, ma'am. Tapos, yan. Close your, then open your other hand po, ma'am. Close your hands. Can you open your hand, ma'am? Okay. So, again, ma'am, close. Sige, close, open. Then, again po. Sorry. Then, open your So, our next assessment, ma'am, is your leg. So, in this assessment po, I need to inspect the color, the distributions of hair, presence of lesions or ulcers, and edema. So, if ever may presence of edema kayo between fitting or non-fitting, I will rate it on a 1 plus 2, 4, and plus scale po. So, in this assessment po is, kailangan nyo pong maghiga, ma'am. So, into supine position po. Now, I'm going to check your legs, ma'am, ha? And also po, palpate for the temperature also, ma'am. If cool ba siya, warm, or hot? Okay. So next is I'm going to palpate your superficial inguinal lymph nodes the femoral and auscultates the femoral pulses over the artery. So, dito po banda sa may singit niyo, ma'am, okay lang po ba touch ko po yung singit niyo, ma'am, ha?
Okay.
I will palpate it. Okay, thank you, ma'am. So, next, ma'am, is I'm going to palpate your popliteal sa likod po ng tuhod nyo, also sa dorsalis pedis, sa paa mo po, then sa tibial pulses nyo po, ma'am. Okay, sa likod. Okay, sa isa po. Ganyan po daw kayo, ma'am. Then dito. Then, dito po sa tibial pulses niyo po. Okay, kita ko na po. Other sides. Okay. So, okay, ma'am. Next is, I will inspect for your varicosities and for your thrombophlebitis. So, can you please stand, ma'am, for checking your varicosities? Stand up. Okay, ma'am, so I'm going to inspect your varicosities and thrombophlebitis. Then, can you turn around po? Okay, I will perform position change test for arterial insufficiency while you are in supine position. Then, I will raise your leg, both of your leg. Then, can you please pump your feet up and down like this, ma'am? Up, down. For 1 minute po. Okay. Okay, thank you, ma'am. So, can you please sit up and dangle your legs po? Sit up like, sit po, ma'am. So, ma'am, there are no signs of varicosities. If ever meron po, I will perform the manual compression test by standing you up. So, can you please stand up, ma'am? So, ma'am, I will compress your lower portions of the varicose vein with my one hand. So, can you please turn around, ma'am? Masakit po ba, ma'am?
Konti.
Other side naman po. Okay po. So as I inspect po, there are no signs of varicosity. So next po is I will perform Trendelenburg test. So ma'am, can you please lie down to the bed? So now po, you are in supine position. Then I will elevate your leg into 90 degrees for 15 seconds. Then I will apply tourniquet to the upper thigh. Then I will assess you. Standing up position and observe and remove tourniquet after 30 seconds. So is it okay po ba, ma'am?
Yes.
Okay, ma'am. I will elevate your leg into 90 degrees position for 15 seconds. Okay. Okay, ma'am. Then I will apply tourniquet in your thigh, in your upper thigh. So, pwede ko po itong tanggalin, ma'am, ha? So, can you please stand up, ma'am? I will observe it po, ma'am, for 15 seconds. Can you please turn around po? Okay, tanggalin ko na po, ma'am, ha? Thank you, ma'am. So, ma'am, as I observe po, there are no signs of abnormalities to your peripheral and vascular system. So, thank you for cooperation po.
Thank you.
So, our last assessment, sir, is your abdomen. So, in this assessment, I'm going to inspect, auscultate, percuss, and palpate. So, expect for any discomfort, sir, like pain. So, our first assessment is I'm going to inspect your skin color, the vascularity, stray or stretch mark nyo po, sir, scars, and lesions po. Also for umbilicus and symmetry of abdomen. So, sir, can you please lie down, sir? Sir, ipataas ko po yung t-shirt niyo, sir, ha? Okay lang po ba, sir?
Yes, ma'am.
So, I will inspect po if pantay po ba siya. Okay, sir. Hinga lang po tayo ng maayos. Normal nyo lang po na breathing. Okay. Okay, now I will auscultate for vowel sounds, noting intensity, pitch, and frequency. So, Hinga lang po na maayos, sir, ha? Then also your vascular sound. So I'm gonna use the vowel sounds for if makahear ba ako ng mga buses, buwis. Then okay. Okay, sir, I'm going to auscultate your abdomen for tone, your liver, and also the spleen. So, magsabi ka na lang po, sir, if masakit siya, sir, ha? Okay. Markahan ko po, sir, ha? Spleen naman, sir. Can you please roll to the right, sir? Okay. Straight po tayo. Okay, sir. Other side naman po. Please roll to the right, sir. Left, rather. Okay. Okay, taas ko na po, sir, ha, yung t-shirt mo po.
Ayun, ma'am.
Sabi ka lang po, sir, masakit po yung percast ko. Okay lang po ba, sir? Okay. Okay, sir, I will palpate your abdomen, the aorta, the umbilicus, the liver, the also the kidney, and also the spleen, and also your urinary. So, magsabi ka lang po, sir, if masakit po yung pag-palpate ko, sir, ha? Okay. Ba, sir? Okay, sir, can you please move towards me? Masakit po ba, sir? Okay. So now I will perform shifting dullness. Next, sir, is the fluid wave test. So, pwede nyo po bang ilagay yung isang kamay nyo dito? Okay. Thank you, sir. Okay, sir, I will perform ballotment test. If symmetrically ba yung abdomen mo? Next is I will perform your appendicitis, the rebound tenderness, your preferred rebound tenderness, also so a sign, and obturator sign, then hypersensitivity sign. So sakit po ba, sir? So, okay, now, sir, I will perform SOA sign and also obturator sign. So, in this test po, sir, I will lift your right leg to check if you feel pain in your appendix side. Then, so, can I lift your leg, sir? Okay. So, next, sir, can you please move sideways? Okay, masakit po, sir? Wala. Okay, there. So, next, sir, is I will perform obturator test. So I will lift your legs, sir, ha? Please best your legs, sir. So, there are no sign of abnormalities. So next is I will test the hypersensitivity test. Okay, pataas po yung t-shirt natin, sir, ha? Pinch ko po yung skin nyo po, sir, ha? Sabi ko lang po yung masakit. Okay, there are no signs of tenderness and redness. Next is I will perform a Murphy test. So in this test po, can you please lift deeply? Tako, sir. Sige, sir. Again, sir. Okay. So, masakit po ba? Okay, sir. Thank you. Okay, sir. Upon assessing your abdomen, there are no signs of abnormalities like tenderness, scars, lesions. So that's all po, sir. Thank you. Thank you for your cooperation.